Welcome to the Operatory podcast, the podcast about burying the dinosaurs in dentistry, moving past outdated technology to find a better way. With me today is a dentist for once, which is amazing to have a dentist on the Operatory today. Dr. Mark Whitlock from Memphis, Tennessee. His practice is called Arlington Dental. It's a fantastic, progressive practice that's doing amazing things, and I'm super excited to have Dr. Whitlock on with me today. How are you doing today, sir?
I'm doing well, my man. Good morning to you. Happy Friday.
Good morning to you. We just met like 30 seconds ago on the call, and I'm really excited to talk to you because you are, it sounds to me like a very like-minded dentist. We talked a little bit about how, we have a shared view that dentistry is kind of outdated, and you are also a fellow dinosaur slayer yourself, correct, sir?
That would be true. I like that, dinosaur slayer.
Man, I love Tennessee. I think it's just a great place. So, and you were saying how chill it is, and it's literally chill here in Minnesota today because it's wintertime. So I don't know if it's like 10 below or what the temperature is, but it's a different kind of chill than you have in Memphis, I believe.
We actually got a little bit of snow today.
Oh, really?
Surprisingly enough, but it'll be gone within the hour. But we did get a little bit last night.
Just calling to Minnesota, you get snow. That's how it works.
That's probably what happened.
Well, we met through basically through OperaVR, the therapeutic virtual reality platform that we've talked about on the podcast before, and I just love kind of hearing sort of not directly, but you were on the news in Tennessee, and you did a phenomenal job, man. I was like, I saw your new segment. I went, if I could be that good, that would be amazing. So nicely done, sir.
Well, thank you. I appreciate that.
Yeah, I thought you just showcased the kind of the use of the technology so well to the audience. So I mean, it sounds like you. I just like you to share your experience and how, because we typically have on here providing the patient perspective Dave Pryor, but he's out today sick. So but you have some of your own patient stories that I'd love you to share for our audience. And I just tell us your perspective on how therapeutic virtual reality has been incorporated into your practice.
Sure. When we got it, I was excited. I think mainly for me, where I could use it during our downtime, just to go into a different space, sitting in the dental chair when we were chilling out. But I, like most people, even though I'm a dentist, I don't like going to the dentist either. And I'm always looking for new options and not just medication to be able to have people calm down in the dental chair. So when I saw OperaVR, I was like, I've got to try this. So when we initially got it, I was blown away with how calming it was for me, and to let my staff use it just so we could get an idea of how to speak to it to our patients, right? So we started out, I wanted to do an audit of my own, really just my own little program to see how well it works. So I had 60 patients come in and gave them a free cleaning. And these were one of our high anxiety patients where they typically had to use nitrous or they needed a Valium before they could come in to get dental work done. So when we had them come in, we explained the technology, what it was going to be like. And then literally I would let them have the goggles on for maybe 3 or 4 minutes just to let them get calmed down from coming into the office. They sit there and they go either to the beach, they go underwater and swim with the fish, and they get in that space. And I always let them know, when I come in, I'm going to talk to you, and I'm going to share with you what I'm doing, but you just stay where you're at. Stay on the beach, and we'll go through this step by step. Very more than half the time with these 60 patients, 30 of them fell asleep. The other 30 didn't even know what was going on with the procedure. And by the time it was over and they take the goggles off, it was like a light had been shined on the dental office because they absolutely loved the experience. I mean, because they weren't sitting in the dental chair anymore. They were, walking through the city or seeing a flower bloom. They were taken away from the anxiety of being in that space where it's really confined. You're really vulnerable, and those issues were not there anymore. It was awesome, and it's been awesome, and it's only getting better.
That's you're going to make me cry over here, because when you're working on a product for 3 years and seeing the transformation in your own practice, when you hear other people's stories, and it's just, I mean, it's so cool to hear. So thanks for sharing that. I mean, I think the
cool.
Go ahead.
Go ahead.
Well,
I was going to say, the cool thing about it is when you have people that come in that are high anxiety, and when they have such a great experience, you actually will have, be it a family member or a friend that comes in or they call in just because of what their friend shared about this VR experience. Because I think as far as I know, I'm the only dentist in the Memphis, Tennessee area that is using it right now, which is a shame, because we all should be, because it's a great product for those patients who just don't do dental work and don't come in because they're scared of the dentist. And this is a great option for them.
Yeah, I mean, the stats are amazing. 22% of patients delay dental treatment because of anxiety, and I mean,
exactly.
And it's so easy. And I think the risk is that we've talked about on this podcast before, but because it's a virtual reality headset, people view it as like the thing that you get at Best Buy, as gaming, or it's like the same thing as a TV, but it's true drug-free sedation. And I still, after using it for the last 2.5 years on patients, it still freaks me out how well it works. It's like, because you don't have the sort of auditory cues that you have with nitrous oxide, the scavenger and things. So if you have a patient with headphones on and they're that relaxed, I don't know. It's been, for me, the big thing that I've seen recently is kind of like what you said. What most dentists and their dental teams do is they put it on themselves, and they're like, yeah, this works. But correct me if I'm wrong. Where it's really the most impactful is when you're working on a patient that you've worked on before that has anxiety, and then they're in a totally different space, and you're like, my God, this is easy, right?
Oh, I had a guy come in and we took his wisdom teeth out, and there would have been no way that procedure would have went as well as it did without having the VR. There's just no way. And we did some Googling and YouTubing about how, there's even clinical evidence that over 50% of pain levels decrease with people that are burn victims. But we've seen orthopedic surgeries with them the surgeons are using the VR to get them out of that space. And it's remarkable, the feedback. And going back to the guy with the wisdom teeth, he absolutely thought it was the best thing that he's ever done in dental chair. And he even said, there's no way I would have been able to do this without the virtual reality. And it just makes you feel really good about giving them another option that most people don't have.
Well, that's just fantastic. And I know could you touch on a little bit, because you're doing some really cool things with marketing your practice, leveraging VR, because you've already had the word of mouth, and so I think that's one of the things that, in my mind, really separates some dentists who are progressive thinkers versus ones who aren't. It's when you're willing to try out not just technology, not just business systems, but also different marketing channels, right? And I don't think of Memphis as like Vegas or even like Salt Lake City, where there's probably not a dentist on every corner and tons of competition. But you're ahead of the curve. So could you talk a little bit how you're leveraging marketing?
Sure. Well, we obviously had gotten on TV with local TV channel here, and what was nice is we were able to have the anchor come in, and she actually tried it and she shared her experience on camera. So it just gave it that much more of a heads up to the community. But, I'm actually getting ready to do a billboard on Monday, and you see these billboards that say, what will you dream about with sedation dentistry? And because sedation dentistry is such a big thing right now. But my take on that is, what will you dream about with VR dentistry? And then sharing the goggles with a patient with the goggles on, and people have no idea what that is. So they call in wondering. And then when you share it with them and you take away the notation of a video game or, you know, being at a military scene, be it Call of Duty or whatnot, they like, oh my God, this sounds great. And they want to come in just to try it out, you know? And once you get them in the office to get them in that space, it's a game changer for referrals and for that patient. It's a game changer for retention and keeping them back in the chair to get the proper dental care.
That's fantastic. And just because you're so awesome and you're on the podcast, I'll announce to you first kind of what we're coming out with next for OperaVR and therapeutic virtual reality, because it addresses exactly what you said. When people call in and say, what's it going to be? We're really organizing and increasing the quality of the content and branding them into different branded experiences. So soon there'll be like a nature walk and world tour, where the first world tour will be Paris, where you'll get to actually have a guided tour where you can have vocals of somebody describing Paris to you, and then there's a 20-minute sort of walk around the city. And so we're really the content is really going to be more focused in easy to understand adventures that will be branded. So you'll say, oh, you can go on an island adventure or underwater, and I'm probably mixing up what they are, but we've really created sort of separate categories so people will understand by the titles where they're going to go, which is kind of fun.
Fantastic. Very cool.
Yeah, I mean
cool.
it's that will be rolling out within the next, I'd say, well, for sure a month, but probably in the next couple of weeks. So around when this podcast airs, the branded adventures will be available. So because that's been feedback that we've gotten is, you know, there's this content that's fantastic, but it's not as organized in a way. So you'll be able to give the patient and say, what would you like to experience today? And we're going to have what we call an evergreen experience for kids, where it's going to be an animated tour through a forest where you're getting guided by a bunny rabbit. So that's coming soon too.
That's been another thing. I'm glad you said that. With the kids in the office, it's been a complete game changer. I mean, kids eat it up, and we've gotten more families in with multiple children just for the simple fact of them being able to go. Because I hear them all the time. Little Johnny will come out and tell Sarah out in the waiting room, I was just in the water. I was underwater with the dolphins. It was the coolest thing. And they just can't wait to get in the chair just to be in that space. And it's so much easier to work on them. It's great.
Well, it's just fantastic. And it's great having you on the podcast. Thanks so much. You know, you know, we don't have dentists actually on our podcast very much. So it's great to talk to a dentist who's pushing the industry forward in a ton of ways, and not just going to repeat the same day tomorrow as you did yesterday, and looking to enhance the patient's experience, which exactly. I think is, that's the reason why we're doing the podcast. So thanks so much for what you do, man.
Oh man, thanks for having me on. Thank you for doing what you do. I greatly appreciate it. Your work is touching a lot of people, Barry.
Well, appreciate it. Thanks a lot. So for more about OperaVR, go to digitalnitrous.com. Look forward to talking to you again on another episode of the Operatory.